Hey, this is Dr. Erdman at Madison Vein and Laser and Madison Medispa. Today I want to talk to you about the second most common question that I get from any vein patient coming in for treatment, which is, how can we safely get rid of all these veins? Other common variations are, don't I need these veins, or where does all that blood go? And the answer to all of those questions, very shortly, is no, you don't need those veins. In fact, your body is already used to living without them, and your circulation will improve once you have your veins taken care of. Now, to understand that and to elaborate on that a bit further, you have to understand how the venous system in your leg is set up. And one of the common analogies that I use for my patients is to have them think about their veins just like the road system. You literally have miles and miles of superficial vein in your leg, and you have everything from big highways to little back alleyways and everything in between. And so that blood to get up and out of your leg has multiple options. And just like if you're driving somewhere and you hit a road that's broken, you can take a detour around it to get where you need to go. Same thing happens in your leg. If you have a broken vein, your body can reroute around it and deliver that blood back up and out of the leg. And in fact, even while you're listening to me right now, you have arterial flow going down into your legs. None of that blood is using any of your broken veins to get back up and out of your leg. It's using all of the other good veins. Another way to think about it, again using a road analogy, is to think about broken veins almost like the wayside off of a highway. Normal venous flow is going up and out of the leg, just like cars flowing past on a busy highway, whereas the blood that's in your broken veins is pulled over to the side and just sitting there. And again, in a normal vein, that should not be happening. So by treating your veins, not only will your legs look better and feel better, but most importantly from our standpoint, the circulation in your legs actually improves. And one of the best ways that that's illustrated is by patients who come in with basically end-stage vein problems where they've developed a big ulcer down around their ankle. And what's happened in those patients is they have so much pressure coming back down the vein in the wrong direction that the arterial flow that's trying to get down the leg to deliver the oxygen and nutrients to those tissues, and especially in this point, the skin around the ankle, that arterial flow cannot get through any longer against all of the pressure that's being pulled back down by the effect of gravity and the fact that the valves inside those veins are no longer functioning to stop that from happening. So what happens in those patients is that that skin no longer gets the oxygen and nutrients it needs to stay healthy, and over time it basically turns to leather and then breaks down and dies and opens up into a big ulcer. The cool thing about this is when you get rid of that pressure coming back down the vein in the wrong direction, the arterial flow for those patients is still there, and now all of a sudden it can get through and re-heal that skin. Now the skin will probably never be the same, it'll probably always be discolored, but you can get rid of those ulcers in fairly short order, usually anywhere from a few months to even a few weeks, depending on how healthy that arterial flow is to begin with. So to summarize, when you have any bad vein in your leg treated, not only will your leg look better and feel better, but most importantly, the circulation in your leg will improve. All right, so next time what I would like to do is to talk about more specific treatments that are available to people nowadays, and specifically talk about why no one needs surgical ligation and stripping any longer. And in fact, if you or someone you know is being told that you need surgery for your veins, why you should go see another doctor for a second opinion. Stay tuned for that. If you'd like to follow us along, click the subscribe button. Otherwise, we'll see you next time.